Hi, this is Deb Zalvin. Thank you for joining us today. Um, we are today going to be talking about different tips and tricks for using your Smart EXP patient engagement solution. And we all know with Smart EXP, you reach patients much earlier in their care episodes, and you're able to stay with them throughout recovery, or in the case of pregnancy and early childhood, until their child's third birthday. So you're really able to build on this connection and have a continuous conversation with your patients. But you also are able to connect with them much earlier in the episode than ever before. And while that really helps you to set patient expectations and improve outcomes like readmission, length of stay, and satisfaction, it also means we have to figure out how to connect with patients that much earlier. So we constantly talk to clients about different tips and tricks for enrollment that work for them. And every client has different situations. Every hospital is set up a little bit differently. But I think that there's so much we can learn from one another. And that's why we've put together this webinar today to share with you. We know enrollment is a basic building block to success, and we want to help you do the best you can. So today, we're going to hear from 3 clients who have had success in this area differently. So I want to welcome Ali Gouveia and Jenny Johnson from UNC Rex Healthcare in Raleigh, North Carolina, Kimba Halliday Clear from Lovelace Women's Hospital in Albuquerque, New Mexico, and Ellen Duran from North Suburban Medical Center, a Health One hospital in Denver, Colorado. So just a couple housekeeping tips, housekeeping items, so that you know what to expect today. We are going to mute all of the attendees, but at any time you can send us a question in the Q&A box, and we definitely want your questions. Each of these hospitals are going to go through their own stories and how they approach enrollment and make Smart EXP work for them. But when they're through, we are going to open it up for a panel discussion, and would love the questions to come from you guys as much as we have lined up questions already. So please send them in. Okay, so I want to introduce Ali Gouveia and Jenny Johnson. Ali Gouveia is a digital marketing coordinator at UNC Rex Healthcare, where she helps manage websites and mobile apps for UNC Rex and UNC Healthcare System. Prior to working in healthcare, she worked in the advertising industry. Ali has a Master of Arts in Interactive Media from Elon University and a BA in Media Arts from the University of South Carolina. Jenny Johnson is a healthcare marketing veteran with many years of experience marketing a variety of service lines. She has most recently been responsible for promoting the Rex Women's Center, mammography services, and blood donation services at UNC Rex Healthcare, as well as several system-wide initiatives. Jenny has a bachelor's degree in both political science and communications from North Carolina State University. So welcome to both of you, and please take it away.
Thank you. Thank you. Well, just a little bit about UNC Rex. We're a community hospital in Raleigh, North Carolina that has really grown to be more of a, regional hospital in recent years. And we're the second largest hospital in the UNC healthcare system, the first largest being our friends at the University of North Carolina Medical Center in Chapel Hill. So a little bit about our status in the area is we're in a pretty competitive market for labor and delivery.
We are. We primarily serve Wake County, and there are 3 other hospital locations within Wake County that have labor and delivery. Not to mention a couple of birth centers that will also deliver.
So it's we're not the only place in the area, and it really is a buyer's market, I guess, when it comes to delivering babies. We like to say we deliver about a kindergarten class a day of babies, which equates to a little over 5,000 births a year. And we also are in a unique position where we don't own any OB practices.
Right, they're all community practices.
So we rely on OBs to, you know, they have delivering rights at our hospital, but it's very important for us to engage with patients as early as we can, because otherwise we're not seeing them until they come to the hospital to have their baby. So we work hard to establish ourselves as a trusted resource for them, and we want to kind of call ourselves to their attention as early as we can in their pregnancy.
And we also want to be a trusted resource for the practices, the physicians, so that we make their lives easier as well.
So before we started using the UbiCare API, we had an average about 55 new subscribers a month to the Pregnancy and Parenting e-newsletter. And on our website, on our maternity section, we have a side panel that encouraged people to sign up for the Pregnancy and Parenting newsletter there. But that's not the only call to action on our site. We've got a lot of things going on. We need people to sign up for parenting classes. We need them to register for their delivery. We want them to sign up for the newsletter. We want them to come in for car seat checks. So, 50 a month was not a bad number, but it's not nearly the amount of people who are delivering at Rex each month. So we really wanted to see that number increase.
And there were other things that we were doing at the time to sign people up. We used some traditional methods as well as having the notice on the website. Of course, we gave out RAC cards to physician offices that we shared and they distributed to their patients. We also distributed the RAC cards with information about the newsletter at birth classes. And we had a notice of it in our printed registration packet that is sent to all the physician offices, and they give to all of their patients. So there was a number of other traditional places that we had put it prior to using that API.
So we had it out in a lot of places, but apparently we needed to make it easier for people. So we did. We decided to engage with the UbiCare API on our use the API on our website to increase enrollment. And at the end of 2016, we hooked the API into our labor and delivery pre-registration form, which we encourage moms that are about halfway through their pregnancies to go ahead and pre-register for labor and delivery, so they're not doing that when they're in a lot of pain arriving at the hospital. So because we were already collecting name and address, due date, and email, which are all the things you need to sign up for the newsletter, we just created an opt-out button on that form. So you're automatically opted in to receive the newsletter unless you uncheck the box. And we immediately saw a huge increase. We went from 68 subscribers in November 2016 to 278 subscribers the very next month. And since then, we've had about an average of 250 to 300 since we've done that. And as you can see on the screen, this is a shot of our labor and delivery page. We have registering for labor and delivery as the call to action on all of our maternity pages. So even though you get to the newsletter in other places, when you sign up for labor and delivery, that box is already checked for you. So if you don't want the newsletter, you uncheck it, but most expecting moms want as much information as they can get their hands on. So people have responded very well and usually do want to receive the newsletter when they're interacting with our site for the first time. So this page highlights where other places where you could sign up for the newsletter. This was our old method. Old, I guess. It's still an option on the site. You can still go and seek out the newsletter and sign up for it here. But we probably get a couple of these a month now that we're getting over 200 just from the labor and delivery registration form.
We also began using a new vanity URL landing page, myrexbaby.com, in early 2017, and it links to the maternity section of our main site. But the page itself is much cleaner, focused just on maternity, and the link to the sign up for the newsletter is more prominent on myrexbaby.com. So we are promoting myrexbaby.com in all of our advertising. So I feel like it's helping to get seen more that way as well.
And you can see from some of these testimonials on the slide here that our patients respond really well to the newsletter. It helps them feel more connected. They feel more confident. They feel like, they're making educated decisions when it comes to their own care and taking care of their child when you get the first year information. And it has done a lot to make them comfortable with coming to us to have their baby when they've been receiving emails for us every week since whenever they signed up, whether it was at 8 weeks pregnant or 20 weeks pregnant. So by the time they show up for delivery, we're already very familiar to them, and that's exactly what we want to accomplish. So just adding on that, we, for us, it was extremely seamless once we set it up. I get notifications when users sign up via the old ways, and we have so many people signing up through the form that we honestly don't even think about it. It's just been
it's made life very easy.
Yeah.
And it's truly been a win-win, because we're like Allie said, we're perceived as a partner from the very beginning, instead of just the place that the patient and their doctor attend to go to have the baby. It's been great. It's been so easy.
Yeah, our physicians like it too. I kind of expected the opposite. I thought we might be sending their patients to them with more questions than they wanted to answer. But they like that their patients have another source, so they're not coming to them with every single little thing.
Or calling them their offices.
Yeah, calling their office at 8 o'clock in the morning. So yeah, our physicians have responded very well to it too.
Great. Thank you guys for sharing that with us. Next, we're going to hear from Kimba Halliday-Clear from Lovelace Women's Hospital. Welcome, Kimba. Looking forward to hearing your story too.
Thank you. Thank you. I'm like all impressed with UNC Rex, so I wish I lived closer so I could see that in person. Lovelace Women's Hospital is one of the hospitals I work at. It's part of a larger Lovelace healthcare system in the state of New Mexico, and it is part of the larger Ardent Health system that is a nationwide system with like 22 hospitals. We are the only women's hospital in the state of New Mexico, but we are not the only birthing center option. We have 2 other hospital systems in our town, and altogether, I think it's 1, 2, 3, 4, there's 6 hospital birthing centers and 2 freestanding birthing centers that are not hospital-based. We average just over 3,000 births a year, and we engage around 43% of our OB patients, and we have been with UbiCare since 2008. So the way we handle our onboarding to the UbiCare platform is that we have an OB navigation program called Loveless Labor of Love. And through our Labor of Love program, we offer moms a one-stop shop to access community resources like our home visiting partners, to help choose an OB. We have employed OBs as well as community OBs. And any of our classes or any other services, we have prenatal yoga and things like that. So we have this program. So any mom that contacts Loveless Labor of Love is automatically enrolled into the UbiCare platform. It's a manual process for us. So we take their information, put it into our database. We extract the names, due dates, and email addresses from our database, and we then upload them into our UbiCare account. And so this gives you an idea of how we do the CSV upload. CSV, for those of us that are not techie, looks very similar to Excel, but it has different stuff on the background. But if you have Excel, you can do CSV. So we are able to upload all our new members every month and drop them into our account, and they start getting their emails usually within 2 to 3 weeks of enrollment. Our UbiCare emails go out with our branding, which is very lovely. So people assume that we have little elves in our office that are putting this content together for them. And it is, it's nice. I mean, we're also able to use this same list when there's a campaign like the flu vaccine campaign or Mother's Day or Father's Day. So we use the same list. As part of our Loveless Labor of Love, we do include the weekly Pregnancy and Parenting e-newsletter as one of the perks that we offer, in addition to our prenatal Mommy and Me yoga classes, our mommy massages, our prenatal education, and all the other things that you see listed there. We do have a website that is part of the Loveless Health System. It's not maternity specific, but there are links for people to sign up for classes. So anybody who signs up for classes, even though they're later in their pregnancy, we still contact them about joining Labor of Love, accessing the yoga classes, the new parent group, and the newsletter, the e-newsletter. Patient-reported outcomes, 75% feel more confident, 88% feel more connected, and 100% feel they can take better care of their child. And what I love is that so many of our moms are first-time moms. They don't know what they don't know. So we can tell them, you know, hey, listen, you know, let's get you into a class. They're thinking, well, you know, generations of people have had babies. Why do I need a class? And then they start getting the information on their telephones that they're actually accessing, and they're like, oh, I had no idea. And then they start reaching out to access those other resources like our parenting and pregnancy classes.
Thank you, Kimba. I just think it's so important, I think, to note that, you know, we see a lot of patient-reported outcomes from all the hospitals that use Smart EXP in all various service lines. And we do tend to see pretty high rates in terms of these outcomes, you know, feeling more confident and connected and taking better care of themselves. But especially as you're having such strong databases, because you've really figured out how to enroll patients in a system that works for you, I think it really means so much more, and something that a lot of our clients often ask about, you know, in terms of the numbers of responses to this survey. So thank you for sharing your story. And next, last but definitely not least, we have Ellen Duran. Ellen is the Community Relations Manager and OB Concierge at Health One North Suburban Medical Center. Ellen has served as the Director of Women's and Children's Services at Health One and was previously the Nurse Manager of the NICU and Pediatric Units at Rose Medical Center, also a Health One hospital in the Denver area. Ellen holds an RN and Master of Health Systems and Administration from Regis University and a BA from the University of Northern Colorado, Greeley. Ellen? Okay, we seem to be having just some technical difficulties hearing Ellen, so hold on one sec, everybody, and we're going to figure out what's going on. If you unmute everybody, then we can hear her. Okay, so I think what we're going to do is we're going to unmute everybody so that we can hear Ellen. And if everyone could, you know, keep any background noises to a minimum, that would be great, since we can't seem to hear her. Why is she not there? Oh, she's on a phone call. Sorry, just one second. Can't hear her. Okay, since we can't hear Ellen, I will do my best of explaining what Ellen does, and I have Joe and Jackie here to back me up if there are pieces that I miss. Okay, so Health One, and we're so sorry about this. So Health One is a system in Denver. It's a system of HCA. They are North Suburban itself is a leader in core measure quality ratings. They have been a JCO top performer for the past 5 years. They have been working hard to improve their birthing and their children's suites and facilities and strategies. And in doing so, they have improved their birthing suites and their children's ER, really, helping to have a new look to the children's offerings that they have. They do 1,246 births per year, and they have been a UbiCare client since 2008. So being a OB concierge, Ellen has a connection with her OB groups, and she works closely with the practices where they are able to query their practice management systems for patient information and then provide it to her, I believe also in a CSV file. And while that's happening, they also have on their marketing side a club that they call the Baby on the Way Club. And so while they're getting patients in from the OBs that they have this strong connection with, they also are using their marketing efforts and their baby club to provide any additional enrollments. And any of that information gets sent over to the OB department, which then gets handed to Ellen, and she inputs into the Smart EXP system. She also, as it notes here at the bottom of the slide, oh, sorry, the slide before, she is able to do personal outreach for pregnancy losses and depression, because having this system allows her to know so much more about what's happening with her patients. So when she gets an alert that somebody has had a miscarriage, she personally reaches out to them and is able to strengthen that relationship and keep that relationship going with North Suburban, even if the patient is obviously not going to be, continuing with a delivery there. So this next slide is some information about their Baby on the Way Club, which I'm sure Ellen would do a much better job describing than I will. But this is, it's essentially a way of creating a VIP experience for expectant moms. What they have found for their staff is that it frees up staff time, that downloading information from other systems makes this a simple workflow for them. And what they meant by that when we helped them create this slide is they're already making use of information that they're already gathering. So they're not having to go ask for additional information. They're simply using what they already have and figuring out, what systems hold what, so that then they can gather that information and simply upload it right where they want it, so they can connect with women earlier. They are also able to recruit patients and keep them satisfied for the hospital. So they're bringing in more patients for the hospital. And of course, they are having a better, more engaged, more satisfied patient experience, which has been very important to them. So now I'm going to open it up to a panel, which I will not join in Ellen's stead, and hopefully Ellen will be able to call in, if possible, to answer some of these questions as well. So do we have any questions? Okay, so the questions that have come up that I would love to throw out to the group of you. Yeah, the first one, can you talk about your relationship with your physician groups that refer to your hospital and really what they're looking for from you and how you nurture that relationship? We know that using Smart EXP, having that strong relationship with the practices can make a big difference in terms of enrolling patients into this system, but understanding what they're looking for and what your relationship is, I think helps to everybody to understand kind of ways to work with practices and get the flow of patients earlier into their systems.
Well, this is Allie and Jenny. I mentioned earlier that UNC Rex does not own any physician practices, so all of our doctors that deliver are community doctors. But thankfully for us, it's a pretty symbiotic relationship. We need them to bring patients, and they need us to provide a facility to deliver babies. So, and most of our practices that deliver at Rex they only deliver at Rex, and they're in the medical office building that we built right next to the women's
on our campus
next to the women's center. So while we don't, they don't get their paychecks from our hospital, but the relationship it's all in the family. And for us, what they're looking for is making their jobs easier. So I think they appreciate that we provide, us providing this information means they don't have to do it. It also, like I said, alleviates some of the questions that they get from their patients and helps assuage some of, a lot of the doubts that come with being a new mom and not knowing what to expect. And it also I think it also affirms their recommendation that we are the place to deliver at, because we're not, we're providing this information to them on a weekly basis, and they come to us the physicians send their patients to us for their birthing classes and the breastfeeding classes. So I think it really solidifies the unity between the hospital and the practices, and, helps patients feel more assured that they're in the right hands and they're getting the quality care that we promised them.
Great, thank you. Kimba, anything you would add to that?
It's very similar for us. I mean, several of our physicians have privileges at our competitors because not every hospital takes every insurance. But what we have found is that for several of the practices, they are happy with our care, our continuity, our labor of love program, which uses your platform, and our quality metrics, that when patients are interested in delivering with us and their insurance doesn't pay for delivery with us, that some people have been changing their insurance plans partway through their pregnancy in order to have the birthing experience that they want. And part of that is supported by their providers who take multiple plans, can deliver in multiple places, who support their decision to deliver with us.
Wow, that's pretty incredible.
Mm-hmm.
Can you also all talk about the relationship between marketing and clinical departments at your hospitals and how you work together and or separately to make this program be a success for you?
Sure. Well, as you can see, Jenny and I are in marketing, but we have a very close relationship with our, what's wrong with that? Prenatal.
Our clinical counterpart.
Yeah.
She's a nurse in the Women's Center, and she works very closely on answering questions that come through the newsletter that are clinical questions, obviously, that we are not going to tackle, and she is in charge of all of the classes, the prenatal classes that are taught and things like that. So we work closely with her to get the information out about the newsletter. We turn to her for information that needs to go in it on our side whenever we want to post to it or send out special emails, things like that. So it's really it's really a joint effort.
Yeah, the way we work together is the clinical staff and the leadership in our Women's Center are like our clients. So, you know, it's our job to serve them and promote their services, but we need their expertise, you know, to be able to adequately promote those services. So that too is a symbiotic relationship.
Great. Kimba, how about at Lovelace?
At Lovelace, this is a clinical department, so we do think differently from marketing, but we work very closely with our marketing team. We couldn't do our jobs without them. We find that we come at situations from different points of view, and as a result, by listening to each other and honoring each other's strengths, we've been able to come up with some pretty creative solutions to outreach opportunities.
Excellent. That's great. It's interesting hearing you both talk about it because you are on the other sides of those relationships and kind of how that works. And we have found so often that success with Smart EXP tends to come when there is a good relationship with both clinical and marketing, because, you know, as you're talking about, there's different knowledge in both areas, and this program brings them both together. So having that strong relationship, I think, is really helpful. I'd love to ask you both, or all three of you, what you and your teams and even your hospitals are thinking about for the future and working to improve upon. You know, what are you working on that you don't feel you're at 100% yet?
Well, this is Kimba. I would like to get 100% of our moms to be into the education that they need and desire. So whether that be in-person classes, online classes, a digital way to ask quick questions, you know, getting 100% of them onboarded to our UbiCare platform would be a top-notch start to that.
Yeah, we agree. We would love to have more two-way communication with our patients. So, you know, right now we're more serving them information, and sometimes people write in, like, reply to the newsletter emails and do ask follow-ups, but not the vast majority don't. So we would really like to create a two-way conversation with our patients. So, you know, so we're not just a place that we want them to get information from us. So we want to be a trusted source of information, but we also want to, you know, for that to go both ways too, and really build that relationship as strongly as we can. With this newsletter, we're engaging with patients earlier in their pregnancy, around 20 weeks, because that's when most people come to the website to register for delivery. But ideally, if they're signing up after their first prenatal appointment in their practices, and so we're getting them for the, you know, the full span of their pregnancy, that would be ideal for us.
Yeah, you know, we've had clients who in the past have done campaigning to encourage more of that two-way communication with patients, exactly what you're talking about, where they send simple, you know, campaigns that just say, hey, you know, I'm here for you and I'd love to hear from you, you know, reach out anytime, to encourage more of that. Because, like, within every week you're saying, you know, ask me, you know, you can talk to me, you can ask me a question, but having like a dedicated moment to say that, I think people appreciate.
Yeah, that's a good idea. You know, we know that people are talking to each other about, you know, the whole gambit of weird pregnancy questions, because we see it on message boards and we see it on local Facebook pages. So, yeah, we much rather them ask a clinician about the weird symptom that they're having than a bunch of strangers who then weigh in with whatever, you know, life experiences they had that might be valid or invalid. But we, you know. Absolutely.
It's so true. And it's one of the things that we talk about a lot with with clients, because there's all sorts of information we can all find on the web right at our fingertips any minute, and it's not always what you want patients to be following.
Right. Yeah.
So here's another question for all of you. Would you like to see an app be an option, or do you find your expectant mothers are okay to receive emails? This attendee says, it seems more and more people prefer apps. What's your experience around apps? And I should also say, do you consider Smart EXP an app?
We actually offer an app to our patients. We have the UNCRX pregnancy and baby app, which has a lot of very similar information in the app, but then we link to the pregnancy and parenting newsletter from there as well. And what we found is people want information from wherever they can get it. So when we launched the app last March, so it's been almost a year, we did not find a decrease in enrollment from the newsletter at all. People want to get information from the app. They want to get it from the newsletter. They want it from their OBs, and they want it from the Facebook group pages that they follow. So the more information you provide to patients, even if it's saying the same thing in so many ways, just kind of validates their concerns and helps them gather their knowledge. And I think for second-time moms, depending on when the last time it was they had a baby, they want a refresher on, what is going on in week 24 of development, and what milestone should I be expecting from months 4 to 6. So I think moms want information wherever they can get it. That's what we found so far.
Yeah, not long ago there was a study that was published, I believe in Pediatrics, that talked about moms saying that they get a lot of different advice from different sources, and also that they don't get advice from sources that they really want it from, such as their doctors and their nurses. And they were talking in that study about how patients are, even if it's given, patients aren't hearing it. And so I agree with you. The more information you can give to patients about whatever it is they're experiencing, what they're going through, the more they want. These are health concerns, it's life.
Well, and I think what we tend to forget is that over the last generation or two, we've lost that sort of in-house generational teaching that comes with growing up in a house with a lot of kids, maybe other relatives with kids, and grandparents in the same home. We don't really live like that anymore. A lot of young people and even more mature moms are going through their pregnancies without strong family supports nearby other than their partners. And their partners are usually just as lost and confused as they are. So they use the internet, they use apps. They really appreciate being able to get what they consider educational support in real time when it crosses their mind, versus having to wait to actually attend a class and save up all their questions for their doctor's visit. And our moms who have been pregnant before, they still have similar needs. They may have a different focus. A first-time mom, is going to be figuring out how to pee and take a shower, and take care of her baby. And a mom who has more experience isn't worried about that, but is still worried about, how do I manage my newborn feeding schedule when my school-age kid has soccer? So they have different needs, and it's up to us as their healthcare providers to kind of point them in the direction of where they can have resources for those needs.
Excellent. Okay, so switching gears to data. What data do you guys look at in terms of this program and also other programs? What are you tracking and following to know more about your patients and what they need?
I think what we look at the most are, we look at monthly subscribers, but we also look at you know, are those in the pregnancy track versus those in the infancy track, because a lot of the special campaigns that we might send out are based on like whether you are pregnant or whether your child is already here. So I think we look at those two data points the most. We haven't dived in a lot into like which particular weeks people are spending the most amount of time reading. But for the most part, we're really looking at, because we'll target just the pregnancy section for our new class that we're offering, or we'll target the infancy section for, you know, something else.
Yeah.
We also track where, like we have gone in and customized our newsletters based on week of pregnancy and week of parenting, with additional resources that we think are important, like links to classes or whatever. And so when we do our data analytics, we're not only looking at it from, you know, how many people have accessed the UbiCare platform that we send out, but it's also when we look at the analytics for our class registration site or for our Spirit of Women site, we look at where those links came from. And so we've seen an increase in moms doing click-throughs from the UbiCare newsletter to the other sites that we also manage. So to us, that shows a little higher level of engagement. We also look at our unsubscribe rates. Since we are an opt-out also, you know, we kind of watch and see, did moms unsubscribe? And are they somebody that we know is still actively pregnant? And you know, when we get a chance, sometimes we have conversations to try and figure out, was there a problem with the content? Was it just too much in your inbox? Or was there something else going on?
Interesting. Thank you. It's really your point about reaching out to moms in order to get them to other resources, I think is like, that's something we hear all the time with people trying to increase their class registrations and, you know, other event registrations. And I think there's absolutely something so key in that your patients are hearing from you all the time with valuable information. And then when you tell them something timely about give them a resource that is timely and makes sense for them, for their care right then, it all clicks together. You know, and that's when like that relationship between marketing and clinical comes into play, I think, so critically, because you can really be using this to increase any of those programs on either side that are happening. Okay, how about any challenges you guys face locally around breastfeeding and maternal care? Like, for example, promoting breastfeeding or concerns about flu shots, postpartum depression. How are you using this to confront any of those issues? What are your issues? Are you using this to confront them, or are you using other things? How are you going about it?
We have used the newsletter to talk about, in the past, to talk about our breastfeeding support services that we're offering, and also notice about flu shots, time to get your flu shot, that kind of thing. So we have utilized it in the past. It's been very successful.
And for us, we are very active in breastfeeding support communities. We recently obtained our baby-friendly designation, but we also have board members for the Breastfeeding Task Force here. That's a statewide organization with local chapters around the state. And we have these conversations around opiates and pregnancy and breastfeeding supports in not only in households, but in places of business pretty regularly. We have La Leche League that meets at our organization. So we're pretty connected with our community, and I think that supports the ladies at Rex mentioned the two-way conversations, and that's where we get a lot of our two-way conversations, is being out in the community, working with these other organizations that serve the same population that we serve.
Thank you. And Kimba, listening to you talk, I think that I forgot to introduce you and read your bio. And I want to apologize to you. I'm so sorry. And I also want to share your bio. I'm so embarrassed. So
you don't have to share my bio. It's fine. We're almost done.
Oh my God, I know, but I forgot. I can't believe I forgot. So I'm sorry. And I'm going to anyway. So Kimba, who we've been hearing from, and I'm so sorry, everybody. Kimba Halliday-Clear has been a registered nurse in New Mexico since 1993 and has worked in various specialties to better the health of the community. At Loveless, Kimba manages the lactation team and the prenatal education programs, and recently helped the hospital achieve baby-friendly status. She's a member of the board of directors of the New Mexico Breastfeeding Task Force. So thank you, Kimba. I'm so sorry.
Oh, don't apologize. It's fine. It's fine.
Well, it's not to give you short shrift at all. I think you have an amazing bio. I love what you do. Okay, so I'm going to throw out one last question for you because I see that we're nearing the end of our time here. And so the last question I wonder from all of you is, if there are external vendors that you work with that gather patient databases or manage your website, that you use to connect to in order to increase enrollment, or other reasons.
Well, our web vendor helped us set the UbiCare API up so that it was feeding into our labor and delivery pre-registration form. But other than that, we do a lot on the ground here in marketing and over at the Women's Center to, once we have the tools, we mostly manage them ourselves.
Great. Will you just also tell us what, for anybody who doesn't know, just describe what an API is specifically, Allie?
Oh, sure thing. API is an acronym. I cannot tell you what the A, the P, and the I stand for, but basically it's a data feed. So we take the data feed that UbiCare exports. We take the data that we receive from our form and we send it through the API to UbiCare. So then UbiCare imports it into the system, kind of like the manual way where some of you mentioned you're uploading the CSV files. We eliminate that step by connecting to the API. So our website and UbiCare's website talk to each other and share that information, so we're not uploading it ourselves. And it makes it, if you're ever on a website and you see someone's Facebook feed or like their Twitter page displayed there with the most recent post, that's an API that's embedded onto the site. Similar thing with us, we just have the two data systems talking to each other and communicating, so we're not having to extract information and then upload it manually.
Perfect. Thank you so much for making that make sense because I can't tell you how many people say, what are you talking about with an API? So Kimba, any comments from you about external vendors that you're working with?
Our website is handled internally by our corporate team, so we don't have a lot of opportunity to customize. So that's sometimes a limit, it's sometimes a plus. But I think that as far as our educational opportunities, in person, we work with local yoga studios, and they support us in our free prenatal yoga programs. And we pretty much use you guys for our patient education arm.
Awesome.
For getting it into their homes.
Awesome. Well, we really are at the end of our time now, and I want to thank you all so much for sharing your stories and your experience. And we have basically understanding your stories and everyone else's that we work with, we have basically written up like the top 10 ideas for how to take your program really to the next level in terms of enrollment. And we've shared them with you here. So one is the last one, number 10, since we count down, to take an iPad with you, or, another laptop, something that you can move around with, to classes or fairs and events and sign patients up right on the spot, or prospective patients. Number 9, connecting early is best, but the hospital is still good. And what we mean by that is that it is, while you want to connect with patients, obviously, as early as possible in the episode, that connecting with patients and signing them up, even during labor and delivery, gives you so much time to still connect with them, for years to come. So don't only get stuck thinking about, the pre part of an episode. You can get them in the middle or the post as well. We also have the ability to text patients a sign-up link. So patients can sign themselves up right through text. And if you want to know how to do that, be in touch with us. We'd be happy to show you. Host a sign-up form on your website. Make Smart EXP part of your patient clubs, like we've heard about today. Number 5, import patient details in a CSV file, also like we've heard about today. Number 4, connect by text. So we know text is a really important way of communicating these days. It's, gaining momentum by the minutes. Everybody texts, don't hold back. And again, be in touch with us. We'd love to talk to you more about text. 3, export emails or phone numbers from wherever you're keeping patient information so that it can be shared over with your Smart EXP system. Number 2, engage your physician practices, and those can be owned or not owned. And, we've heard strategies for that today, and we would be happy to talk to anybody further about, ways that make sense for each of your individual situations. And lastly, as Ali was just talking about, connect your forms to your Smart EXP solution. Any forms, anything that we can have an automatic connection, as Jenny was saying, and Jenny and Ali were saying, it simplifies that workflow, creates a lot of efficiency, and it's not hard to set up. We'd be happy to help you. So I want to thank you all again for joining us. I hope this has been helpful for all of you, and thank you especially to Ali, Jenny, Kimba, and Ellen for sharing your stories today.
Thank you.
Thanks, all.
Yeah.